let's discuss other chemical classes of antipsychotics. First is butyrophenons. Haloperidol has little anticholinergic action and is less sedative and hypotensive than chlorpromazine. However, there is a high incidence of EPSEs. Atypical drugs are so called because they are associated with a lower incidence of EPSEs and may be effective against negative symptoms, except cognitive impairment. They are better tolerated than other antipsychotics, but may cause weight gain and sometimes type 2 diabetes. Clozapine is regarded by some as the only truly atypical neuroleptic because it is sometimes effective in patients refractory to other neuroleptic drugs. The drug is restricted to this group of refractory patients because it causes neutropenia in about 3% and potentially fatal agranulocytosis in about 1% of patients. Blood samples are required regularly to monitor white cells. Clozapine is a partial agonist, and it is thought that it may reduce the positive symptoms of schizophrenia by blocking D2 hyperactivation in the mesolimbic pathway, but provide enough D2 stimulation in the nigrostriatal pathway to prevent EPSEs. The negative symptoms of schizophrenia are thought to be due to underactivity of the mesocortical pathway that possesses mainly D1 receptors. Another suggestion is that the atypical action of clozapine is because of its potent block of 5-HT2A receptors. Risperidone is non-sedative and lacks anticholinergic and alpha-blocking actions. It blocks 5-HT2A receptors, but is a more potent antagonist than clozapine at D2 receptors. At low doses, it does not cause EPSEs, but this advantage is lost with higher doses. Sulpiride is a very specific D2 blocker that is widely used because it has a low liability for EPSEs, and although quite sedating, can be well tolerated. It has been suggested that sulpiride has a higher affinity for mesolimbic D2 receptors than striatal D2 receptors. Aripiprazole is a newer drug. It is a partial D2 antagonist and a 5-HT2A antagonist. It is also a 5-HT1A agonist, and activation of these receptors indirectly increases dopamine release in the prefrontal cortex and may reduce negative symptoms and possibly executive function. Let's talk about depot preparations. Schizophrenic patients are now treated mainly in the community. This has led to an increased use of long-acting depot injections for maintenance therapy. Oily injections of the decanoate derivatives of flupentixol, haloperidol, risperidone, olanzapine, and flufenazine may be given by deep intramuscular injection at intervals of 1 to 4 weeks, but these preparations increase the incidence of movement disorders. So that was all for today. Keep following sqadia.com for more such videos.